Hi, my name is Paul Secor, and I'm the Vice President of Philanthropy for the Mental Health Association of Central Florida. And today we are celebrating World Mental Health Day. And instead of just posting a graphic or an image or maybe bullet points of tips, we want to take a deeper dive and see how mental health relates to different representatives and different communities, groups, and demographics. And so with me today, I have Cherlette McCullough, who is the founder and CEO of Centerpiece Therapy. Cherlette, thank you for joining me.
Thank you for having me, Paul. I think this is so important.
Well, this is
Thank
exciting. I think we're going to take a deeper dive, and I know that you've really been involved in the mental health space as it relates to the African American community, and that's what we want to talk about today. But before we get into that, if you can tell me about how you got involved in mental health and what your professional background is.
So, Paul, I started this journey back in 1999 when I graduated from Bethune-Cookman College. My undergrad degree was in criminal justice, and at that time, my goal was to be a probation officer.
Okay.
So, I graduated in 1999 and I tried adult probation for about 6 months, and it did not work for me. And then I went over to the Department of Children and Families and started working with the Child Welfare Program and fell in love with that program in case management. And I was able to work my way through the ranks from a case manager to a program director in Orange, Osceola, Seminole County, Lake County, and Palm Beach County. So I traveled around Florida in that position as a program director. And what I found, Paul, was that I was very passionate about helping families and helping people through the system. But what I noticed is that a lot of the families, they didn't only need resources that we were connecting them with, but they needed mental health treatment. And that's when I decided to go back to earn my master's degree in mental health counseling and then pursued licensure, which is a whole other beast. And that's where I started that journey and then came into private practice. And I've been in private practice now for about 7 years.
Okay. So you started out on on the highway and you just kind of changed lanes a little bit, but it seems like you're always on the same highway, it sounds like.
Absolutely. I love social work. I love working with people. I love working in the community. So now I get to do all of that under one roof.
Okay. Well, one of the things when it comes to mental health is in mental wellness, especially, we talk a lot about stressors and managing stressors and acknowledging stressors, right? And
Right.
it's been very interesting because as we're doing these videos, we're uncovering that different communities experience different stressors that are shared often to them. So when you look at the African American community, do you feel like there's unique stressors that may impact, the African American community's mental health and mental wellness?
I absolutely do believe that we have some unique stressors that affect our community, affect our mental health. One of them is the obvious one. I know a lot of people hear about it, is the systemic racism. You know,
Mm.
it's totally different, and that affects your mental wellness, your mental health altogether. Another one is poverty. There's a number of our communities who are, who are experiencing poverty, and it's not only from one generation, but that poverty mentality is shared from one generation to the next generation. So it takes someone in that lineage to break that pattern of poverty or that limited mindset. Those are two that come to mind when I think of our community.
And I'd say,
Mhm.
especially when you look at finance, that's a huge stressor. People say that, financial uncertainty or financial stress or like loss of a loved ones are sometimes the top stressors. So that would seem to make a lot of sense in that case.
Absolutely. And lack of education, and that goes from generation to generation as well. Not knowing how to educate ourselves on different things, just illiteracy is another one that comes to mind when it comes to our communities that affects our mental health. Because when we aren't accepted or we feel that rejection or we're not able to go to the next level or we're not able to have access to different things or different rooms, it could really affect us. It could cause some anxiety, it can cause some stress, some depression as well. And I've seen it so many times in my practice around African Americans who want to break these cycles or want to bust through these ceilings. But these things that we're talking about now, they really affect how a person can move forward with their energy or their motivation.
And
Yeah.
all of this challenge, like you said, structured in the systemic racism too. So you're trying to do these things while the odds are stacked against you in effect.
Absolutely. And not only stacked against you, but it's stacked against your entire family. So where
Mm.
do you go for help? You know you want to reach for something better or you want to experience something better. But if everyone around you, they don't have the keys, of hope to open a door for you, how do you do that? Do you just lose hope at that point? So those are some things specifically to the African American culture that we deal with on a day-to-day basis. And it doesn't matter sometimes, Paul, your socioeconomic status, you could still experience these things now in our community.
Very true. Well, one of the things is we try to we acknowledge that there is stigmas when it comes to mental health in general. Unfortunately, our country doesn't see mental health like they see physical health. But it seems to be even more of an issue in the African American community, and even a greater resistance to it. Would you agree with that hypothesis? And if so, why is that the case, do you think?
I would agree with that. If a culture or a ethnicity has gone through what we've gone through, systemic racism and oppression, bigotry, and all of those things, it would be really hard to be able to trust someone who says that they can help you, who don't look like you. And then we have been taught from generation to generation that whatever problems that we have, whatever we're going through mentally, we keep it in our households or we take it to God in prayer or we take it to church or we talk to the pastor. But the challenge with that is a lot of people who look like us are not trained to treat mental illnesses, so
Yeah.
it causes that issue and we get into this cycle of, should I get help? Do I deserve to get help? Who do I go to? And then we have this other issue when it comes to stigma is, who do we go to? Who do we go to for help? Do we go to people who do not look like us, who we feel who have totally rejected us, who
Mm.
our parents say have rejected us? We have this issue with trusting other groups of people, who don't look like us. So we band together and we try to fix those problems ourselves, but not understanding that without proper treatment, things can get worse for us mentally.
So how do we get, by the way, I just, on a side note, that seems like a massive pressure on the pastors in the African American community, right? Because you have to be everything in train. So just before I get into my next question, I kind of want to explore that. How do the pastors deal with that issue? And do you feel like they're connected with the mental health community?
Well, recently, Paul, in the last like 3 years, I've seen so many African American pastors who have reached out to me and to other therapists about coming into their churches and doing workshops or coming on Sunday mornings and just talking about mental health or what mental health is. I've seen a little turn with a lot of churches being open to talk about mental health and encouraging their parishioners to go out and seek help when it
Mm.
comes to mental health. And I've had pastors also reach out to me from the African American community asking, can they get a training on what does it look like when it's time to refer someone to a mental health counselor? So things like that I've seen recently here in our community in Central Florida, a number of pastors who have reached out. Also, Paul, I've experienced pastors who have hired me to do different workshops with
Okay.
different members in their churches and who have referred their parishioners to me for mental health counseling.
Okay. Well,
But I do think, Paul, just to add to that, I think we still have a long way to go because there are a number of pastors that I have talked to who do not believe in mental health counseling. And I think that's where it's my responsibility and other African American licensed therapists to really talk about that intersection of mental health and faith to normalize it.
that's so true. It's a difficult thing, I imagine, to work through for the pastors, because on one hand, God is omniscient and I'm an extension of God, so I'm all knowing.
Right?
So why do I need to reach out? I have everything I need right here.
It's
But
true.
it's but the other philosophy could be like, hey, because of that, you should take advantage of all the knowledge that is out there to you and seize
Right.
it, yes, right?
It's true, Paul. And it makes me think of this thing around people feel that when they come to therapy, they're just going to talk. It's just talking. So some pastors feel like they're just going to talk to you, so I can just talk to them. And in
Mm,
counseling, it's totally different. We have a trained ear, and we're educated in different modalities of how to treat different mental illnesses. So someone can just be saying, I'm sad, but if you don't know how to really assess that person, they could be suicidal sitting right there in front of you, and you don't know the cues, to look for or questions to ask. That's why I think it's so important that pastors do work alongside us in the African American community.
that makes sense. Now I know there's a lot of quote opportunity to make inroads through the church, through the pastors. What are some other ways that we can reach through to the African American community and get them to access services? Like the Mental Health Association of Central Florida, all the services we provide are free, and we're constantly trying to push them out to the community and
Right.
make people aware. What do you feel like are some ways we can connect and everyone can get the African American community more involved in mental health services?
And I think that's so important. I think really targeting some of the African American churches, some of the African American groups that are here in Central Florida, offering free services to them, coming out and just talking, doing a workshop on mental wellness. I think the main thing, though, I think is important is having things just like what we're doing today and pushing it out to the community. So normalizing these types of talks, every opportunity that we can, normalizing talking about mental health in the African American community and understanding that talking about mental illness or talking about mental health does not mean that you have a problem. Also, by addressing your mental health, it doesn't mean that you're weak. It doesn't mean that it's something to be embarrassed about. It's just like physical health that you said
Yeah.
earlier, Paul. Just as you would take care of your arm, just like you would take care of your teeth, you would go to the dentist. Why not do the same thing for your mind? But a lot of us, because we can't hold our mind in our hands and we can't see the fractures in it or we can't see it bleeding, we tend to ignore it. But now I think to answer your question, normalizing these types of talks, the Mental Health Association, I think, is doing a great job in normalizing. I think that the Mental Health Association is going down all types of avenues just to get the message out to people. And I think that the association is making a big difference in our community.
Well, thank you. And I should have done in my introduction that you're also a board member of the Mental Health Association of Central Florida. So you're very familiar with the services and actually help to guide, where we're headed as an organization.
Absolutely. And we
All right.
do so many things free for the community. We have some very good resources for people here around mental health.
Yes. And that's what we're all about is trying to get those resources into the hands of people that need it. Now, one of the
Yes,
things you mentioned earlier was that there is definitely an underrepresentation when it comes to African Americans in the mental health field in terms of professional positions. And I think it's really important, like you said, when you're going to start to talk about your deepest thoughts, the things that are most troubling you, it's often you want somebody who can identify with you, who can understand what you're going through. And so what can we do to get more African Americans involved in mental health in terms of the professional positions?
I think that's extremely important. And I'm seeing a lot more African American women and men who are now majoring in counseling and moving towards licensure as well. But I think making that information about how to become a therapist, making that very visual for people, because some people have the interest, but not being able to know really what it takes to become a therapist. I think people lose interest with that and not having that guidance for that. So I think people like myself and other licensed clinicians who are seasoned, I think it's our responsibility to make it known how to become a therapist and lending our services to the different universities to talk to students about becoming a therapist and mentoring. Also, creating mentoring programs, which I do in my practice for those the young and up and coming therapists. I make myself available for them, answer questions for them, and just normalize that talk around what it takes to be a therapist and what the life of a therapist really looks like.
That's a great point because I know from the layperson's perspective, when you look at all the different tracks, like we talked about earlier, the different lanes you shifted, right? The different tracks, the different licensors, the different certifications, all that, it could be kind of like, whoa, I just wanted to help people, like what run that by me back again because that sounds kind of complicated. So
It's
I think there's
true.
a lot to be said for that. So I guess you're really in for to demystify that process and get it into the hands of the young people, huh?
Right. But Paul, it is a very tedious program, just to be honest, because you have to earn a bachelor's degree, and then you have to earn a master's degree, and then you have to sit for 2 to 5 years for licensure. So in that process, you have to also do a practicum, which is about 3,000 hours.
Wow.
And you have to take the exam, and all of these things cost. None of it is free. And
Yeah.
while you're in the postgraduate program, you have to pay a clinical supervisor to supervise you while you're doing the work. So it takes a while to become a therapist. It's not that it's not doable, but it is tedious, just to be honest. It takes
Yeah.
time. It absolutely takes time, but it's so rewarding. And there are people here that can help you. There are a number of therapists just like me who enjoy helping therapists get through the program, giving them a place to do their practicum. And the Mental Health Association also offers internships as well.
Absolutely.
Mhm.
Yeah, we have a lot of interns. We actually, some of the programs we run couldn't exist without the help of the interns that really provide that grassroots, service that we need.
Yes.
So it's
Yes.
great stuff. Well, I know we touched on a lot of different things. I'm sure we can talk about like for hours about all those different aspects of it when it comes to the African American community and mental health. But is there anything we missed? Anything you wanted to touch upon that we didn't cover?
I think, Paul, you covered everything when it comes to mental health in the African American community. Just reaching up and getting the help that you need, and understanding that reaching up for help doesn't mean that it's a weakness. It doesn't mean that it's a problem. Actually, it's a powerful thing, and it's more empowering to get help for your mental health than not to. So
Very
normalizing
true.
that in our community.
All right. Well, I heard you say that you were open into mentoring people and providing help. And of course, you have a business which also provides therapy. If someone wanted to get in touch with you, where should they go? What should they do?
They could always call our office. It's 407-230-4582, or they can visit the website, which is www.centerpiecetherapy.org.
Well, this has been great, Cherlette. I appreciate you celebrating World Mental Health Day with us and just want to thank you for all the time today.
Thank you.
All right. So everyone else, we appreciate you watching these videos, and we have more of them on our website. You can go to mhacf.org, where you will find these different videos as well as lots of information about how you can get help for mental health services. Thank you so much.